All right, it's 10 minutes past 7, so let's go straight into this class. Good evening. I believe everyone knows who I am. My name is Rita Odinye Chukwumanafa, okay? I'm currently in year 3. I'm a medical student and I'm a wellness consultant. And we're going to be discussing 8 warning signs of a stroke, okay? As a hypertensive patient, you are at risk for 3 major things: a kidney disease, a stroke, and a heart failure. Okay. So stroke is one of those medical conditions that kill people faster, especially hypertensive patients. So we're going to be discussing some signs that that if you do notice, it means that a stroke is coming and you should see your doctor right away. Okay. And this is typically 1 week before this happens. All right. So this class is majorly for us to protect ourselves. Okay. So please, if at any point you cannot hear me, kindly let me know in the chat because I can't unmute everyone. So many people would have noisy backgrounds. Okay. So just so that you can hear me loud and clear, kindly use the chat if at any point you cannot hear me and if you cannot see my screen as well, okay? So what is a stroke? A stroke is basically damage to your brain because your brain is no longer getting oxygen or nutrients, okay? So stroke majorly focuses on your brain, okay? And there are 2 types of stroke. We have an ischemic stroke and we have an hemorrhagic stroke, okay? Now, if your brain is such an important organ, right? And if at any point you are lacking oxygen to any part of your brain or even nutrients to any part of your brain, it can cause serious damage, okay? Because your brain is always active. When you are awake, when you are sleeping, it controls your autonomic functions like your breathing, it controls your heartbeat, it controls your digestion. When your body is too, it also controls your body temperature as well, right? It controls your walking, your eating, your writing, your motor skills, things that keep you active, things that keep you alive as a human being. Your brain controls all of that. So if it's a partial or either a complete loss of oxygen or nutrients to your brain, even if it's just 10 seconds, it's a very serious thing, okay? And it can damage the brain and also cause adverse effects to your health, okay? So if you have a blockage for just 10 seconds, you can go unconscious. And if that blockage lasts for just 4 to 6 minutes, you can have a permanent damage to your brain, okay? So let's talk about ischemic stroke and hemorrhagic stroke, okay? So an ischemic stroke it covers 87% of all strokes, okay? And it kills people immediately about 3% of the time. Now, if you suffer an ischemic stroke, you can recover, okay? Recovery is not impossible, but your quality of life is going to be impaired, which means that you wouldn't be 100% anymore, okay? And an ischemic stroke is basically a blood clot. So if you look at my diagram here, and I hope that you can see my screen and my blue pointer, okay? If you focus on this blood vessel here, you can see that it splits into 2, right? And this blood vessel here, we can see that there is a blood clot. Now, when this blood clot was in this larger blood vessel that splits into 2, it could move. But now that it's about to get into a smaller blood vessel, which is what your blood vessel, that's how your blood vessels are. That's how they operate. They go from big and then smaller and then smaller, and then they divide into capillaries, okay? And they provide oxygen, they provide blood, they provide nutrients to different parts of your brain. Now, if that blood clot happens to get into a smaller blood vessel and it's unable to move, it completely closes up that blood vessel, right? And if this happens for 10 seconds, someone can literally go unconscious. And if it happens for 4 to 6 minutes, whichever part of the brain that this particular blood vessel right here is supplying oxygen and nutrients can be damaged permanently. Okay, so this is what we call an ischemic stroke. Okay, Mr. Victor says he doesn't have audio. Please, can anyone hear me? I hope that it's not a general issue. Can everyone hear me? Hello? Okay, okay. So let's move on. So as I was saying previously, when you have these blood clots trying to pass through a smaller blood vessel, it can close or block that blood vessel, and oxygen nutrients will not be able to get through that particular area of your brain. If that area of your brain is what controls you being able to walk, then you can have, you have poor coordination of your muscles. You won't be able to walk properly anymore. Okay. Okay, thank you everyone for confirming. So we have a hemorrhagic stroke. Now this makes up for 13% of all strokes. Your ischemic stroke makes up 87%. Okay, and a hemorrhagic stroke is a lot more dangerous than an ischemic stroke. Now this kind of stroke is what kills people over 50% of the time, immediately. So if someone suffers from a hemorrhagic stroke and they are very unlucky, and they fall into this category of over 50%, then they can die on the spot. Okay, and we are trying to prevent both an ischemic and a hemorrhagic stroke, okay, because they can kill someone immediately. Okay, now this type of stroke, there is nothing blocking a particular blood vessel. What goes on here is that you have a very high force moving through your blood vessel, and your blood vessel just keeps getting weaker and weaker and weaker, and all of a sudden it erupts. Now when that blood vessel erupts, which means that there is now an opening, right? It's just like you have an injury or you have a cut, and blood starts gushing out. That's the same way a blood vessel can gush out in your brain, okay, and then it causes a spill, or basically a hemorrhage, okay. And what happens now is it gets between your tissues and it gets in between your brain and your skull, okay. And what happens is the pressure, because blood is not supposed to be there, right? And even that particular part of your brain that is supposed to be getting that blood that is now spilling where it's not supposed to spill is not being, oxygenated. That particular part of your brain doesn't get any nutrients because the blood that is meant to go there is going somewhere else. Okay, so you have more pressure between your skull and your brain, okay, and blood doesn't get to its destination. So if you have a hemorrhagic stroke and it happens to you for just 4 to 6 minutes, it can permanently damage that side of your brain. So if that side of your brain is what enables you to hold a spoon, to hold a pen, to be able to talk, then it's gone, okay? Permanently, it's gone, all right? Now, we have something else called a transient ischemic attack. I wouldn't call this a stroke, okay, because we have only 2 types of stroke, but some people regard this as a stroke anyway, but it's called a transient ischemic attack, okay? Now, this is very temporary and it cannot kill. Now, what happens is our plaque is back here again, okay? Plaque is what causes this transient ischemic attack. So if we look at this diagram here, you can see that it sort of reduces how much blood can pass through that particular area, okay? It's sort of reducing the diameter of this particular blood vessel, right? And it can also deprive oxygen to whichever parts of the brain this blood vessel is meant to get oxygen and blood and nutrients too. Okay. Now you can recover from this fully. Okay. It's not something like a hemorrhagic stroke or an ischemic stroke. You can recover 100% from this. There is no permanent damage. But the thing is, this transient ischemic attack is what we call a mini stroke, or we call it a pre-stroke or a warning stroke. Okay. And the thing is, 1/3 of people who have this TIA, this transient ischemic attack, suffer from either an ischemic stroke or a hemorrhagic stroke in less than a year. And 43% of people who have this TIA suffer a full stroke. I remember full stroke is either ischemic or hemorrhagic, right? They suffer from a full stroke within a week. So this type of attack, this transient ischemic attack, it's very important that we know, because this is like the warning for you. This is like it's like a preview, okay, of what is going to happen in about a week. Or if you are part of the 1/3 of people, then in about a year. Okay, that's why people can suffer from strokes over and over and over again. They probably had a transient ischemic attack in the first place, and they didn't know that it was an attack and not, the stroke itself. And they probably didn't, go through the right treatment options, and then ended up suffering a full stroke. Okay, so we are going to, or should I say, the focus of our class today is going to be, how can you detect a TIA so that you don't have to suffer from the real deal, which can kill somebody immediately and which can permanently damage your brain tissue? Because your brain is not like any other part of your organ that it can rejuvenate itself. Once your brain cells or your brain tissue dies, it's gone. Okay, you can't recover from that. So how can we notice a transient ischemic attack and prevent ourselves from getting either a hemorrhagic or an ischemic stroke? Okay, so let's move on. Can you catch the signs of a stroke early? The answer is no. As someone, a human being can simply be walking on the road and they can slump or they can suffer even a TIA, right? What we're going to focus on this class is you knowing the difference between a TIA and the full stroke itself. And when you do suffer a TIA, what signs should you look out for so that you don't suffer the main thing? Okay, so the difference between a main stroke and a TIA is the symptoms, the signs are all the same. Okay, so the signs I'm going to show you in a bit, they are all the same with both the TIA and the full stroke. Okay, but the thing is, they differ in severity and they differ in duration. Okay, so your TIA, when people suffer a transient ischemic attack, it usually lasts for just 5 minutes maximum. Okay, and 43% of those people that suffer this TIA within 5 minutes can suffer a full stroke in just 7 days. So it's very, very important that we know, okay, what are the signs of this TIA? How can we detect it when it comes and, protect ourselves from the full stroke that would cause a permanent damage? We don't want to be part of that 3% that would die immediately, okay, or even over 50% that would die of a hemorrhagic stroke. Okay, so I know usually I don't like talking about this type of things with people because it can scare people a lot, but at least we are here to learn, right? So that you can protect yourself and also protect someone that you love, okay, that is close to you. So what are the warning signs of a TIA? Okay, 1 week before the real deal comes. So we have to talk about weakness. Now, a key word amongst all the signs, all the warning signs I'm going to tell you about today is that they come suddenly. So on a regular day, you wouldn't experience something like this. It comes sudden, okay? So your weakness is usually unilateral, and it's unilateral, meaning that it happens on just one side of your body, okay? And the reason is that you have two hemispheres of your brain, okay? You have the left and the right hemisphere. And the right hemisphere controls the left side of your body, and your right hemisphere controls the left side of your body, okay? So if you have either a plaque buildup, or you have an ischemic stroke, or you have a hemorrhagic stroke, depending on which side of your brain that is affected, the other parts of your body is going to, experience sudden weakness. So let's assume you have plaque buildup in the right side of your brain and you suffer from a TIA, then the left side of your body can, experience a sudden weakness, okay? And if you have a plaque buildup that will cause you to have a TIA in the left side of your brain, then the right side of your body suffers this weakness, okay? And you can notice the weakness first off from your face, okay? First off, you feel it. Before we even go to the facial drooping, you just feel that one side of your body is weak, okay? Especially your face. And then your arm and your leg, you notice that you are not able to move your arm or your leg anymore. Your facial drooping, many of us know about facial drooping, is basically this image that I put here. You can see one side of the body, one side of the face is just drooping, and this image has an uneven smile, okay? So this is an example of facial drooping. If you also have difficulty swallowing or difficulty chewing, okay, it's also a sign, a warning sign of a TIA. Okay, and you should do something about it. Don't just say, oh, I experienced this one time. All of these signs I'm going to explain here. If you experience at least 5, please see your doctor. Don't just brush it off and say, oh, it's not a big deal. It just happened one time, okay? Because this is a serious thing, okay? And if you also have a loss of fine motor skills, for instance, if you pick up a pen, you are unable to write, you are unable to button your shirt, you are unable to iron, you can't open doors, it's scary, okay? And it's a sign, it's a warning sign for you. If you also have difficulty speaking, okay, these are just some of the things that you should be wary about, okay? So very, very sudden weakness, which means that on a regular daily basis, you wouldn't suffer from anything like this. It just happens very sudden, very unexpected, okay? So let's move on. The next thing is sudden loss of balance. So if you have difficulty moving or standing still, so basically if you want to stand up, you fall down, okay? And that has never happened to you before, okay? Then it's something that you should be cautious about, okay? The next thing is cognitive changes. So if you have a decrease in understanding language, so everybody hears and understands English, right? But in your native language, if you are unable to hear what somebody is trying to say, and on a regular day, you understand, it's something that you should check out, okay? Even writing, okay? And also speaking your language, if it becomes a difficulty all of a sudden to understand it, to speak it, and to write it, then it's a problem, okay? If you also have sudden confusion, okay, let's say you work most of the time, and I'm just trying to think of an example. Perhaps your boss or you ask a staff to do something and they tell you that they've done it, and it's just like you're just confused all of a sudden, okay? It's not something that you should shrug, and just say, oh, it's not a big deal. It's a big deal, okay? If you're unable to solve problems and make decisions as well, it's also a sign. And if you have loss of memory or you are unable to recall, I think this is what fits my example more. If you have loss of memory or you can't recall things as often as you used to, okay, remember that all of these things are sudden. It's not how you are, okay? And it's not something that you've also been diagnosed of, because I know some people have Alzheimer's. That's a whole different thing. you are already diagnosed of Alzheimer's, okay? But if this is something that is very sudden, you usually don't have memory loss on a regular day. You are able to recall things sharp on a regular day, okay? But all of a sudden you are unable to do that, then it's a problem, okay? So take note of your cognitive changes. Now, usually, some signs of stroke that is very common is blurry vision or double vision, okay? And also, you know that when you have tingling or numbing in your limbs, like your fingers, your toes, then you know that it's also a sign of stroke, right? It's very common to know that blurry vision and tingling or numbing of the limbs it's a common sign of stroke, okay? But your other senses as well can be affected, okay? Like your hearing, your sense of touch, your sense of taste, and your sense of smell, okay? So your 5 senses also contributes to warn you about a TIA and also an ischemic or a hemorrhagic stroke, okay? So let's move on. The next thing is extreme nausea or vomiting. Again, all of these warning signs are sudden, okay? If there's nothing wrong with you that will cause you to be vomiting, then it's something that you should check out, okay? If you also have a very sudden severe headache, some people tell me sometimes that they have headaches. Usually it's a side effect of your antihypertensive medication. But when you have such a headache that it's like someone is using a knife to stab you in the head, then that's a very serious problem, okay? Especially when you don't experience things like this on a regular day, okay? It's something that you should check out. If you have sudden fatigue or just overwhelming tiredness, like you can be very active in the morning and all of a sudden you are so weak, you can't even move your body, it's a warning sign. Okay, if you have personality changes, now this is something that somebody would have to tell you. You probably wouldn't notice it yourself, but if you are just behaving some type of way, in a very sluggish way, someone can tell you, are you okay? Usually doctors can tell when they just look at you, they just know if you should get to the hospital right away. As I was reading a book one time, a lady, she told her dad that he needs to get to the hospital right away just by looking at him. Okay, she saw that he's not okay, and the man ended up suffering a stroke like 5 minutes later on. Okay, so if you look at someone that you are very close to and the person is not just looking okay, the person is just looking very dull and weak and sluggish and is unable to move or walk properly, and then you start seeing things like facial drooping, you know, please get the person to the hospital immediately, okay? And the other thing is loss of consciousness, okay? So basically you faint, okay? You don't know where you are anymore, or you just like black out, okay? Then it's something that's, when you do wake up and be conscious, or hopefully someone is there with you when you lose consciousness, but when you do find out that you don't know what's happening. Hi, everyone. Can you hear me? I was kicked out of the meeting. I'm so sorry. Please, can you hear me? Kindly let me know in the chat. Okay. Where did I lose you guys? Where did I stop? Because I was kicked out and I was talking. I didn't even know that I was kicked out. So does anyone recall where I stopped? Where did you lose me? Okay. Do you recall where I stopped? At what point did you stop hearing me? So I can go back. Okay, personality changes. So I was saying, I gave a story where a lady, she's a doctor, she came for her family dinner, I think, and she was able to detect just by looking at her dad that something was wrong with him, and he had to be taken to the hospital right away. So when someone is looking at you, especially if it's someone that is very close to you, and you experience or you notice that the person just looks sluggish, okay, or the person just looks weak, not as they used to look, there's just something off about the person, or it seems like the person's skin is getting pale, okay, then it's a warning sign of stroke. Uh-oh, someone says she can't hear me. You should be able to hear me if you connect your audio, okay? So again, loss of consciousness. So if you ever lose consciousness, hopefully someone is there with you at the point where you either faint or you just black out so that they can get you to the clinic. But if at any point you do have a loss of consciousness, then it's a warning sign to you, okay, that you should get to the clinic. You can be suffering a TIA at the moment and you wouldn't even know that you are suffering a transient ischemic attack at the moment, okay? And within a week, it's very possible that you can then suffer a stroke, okay? So I would like to get your feedback. How are we doing? Do we understand everything that I've said? Are we together? Please give me some feedback so I can know if we are on the same page. Am I making it very clear and easy to understand? Okay. Okay. Thank you. So let's discuss some risk factors, okay? What exactly is going to cause someone to, first off, suffer from a TIA before they then suffer from a full-blown stroke? The first thing is if you have suffered a previous TIA in the past. So look back at your life and think of any points in life where you have ever suffered a facial drooping, a sudden weakness. Some people actually suffer from weakness and fatigue. I know that, but the key word is sudden. If you are a very lively person, or if your weakness is just off, you just never felt that way before, okay, then you know that it's something that, it's a warning sign of a TIA, okay? So just think back at your medical history. If you've ever suffered a TIA before, or even a stroke before, because stroke, you can suffer from a stroke 2 to 3 times, okay? It's not something like chicken pox that you just suffer from it once and you are done, okay? It can keep happening and happening and happening again. So just recall your medical history in the past if you've ever suffered a TIA or either of these warning signs I've already talked about. The next thing is blood disorders, okay? So if someone is a sickle cell, they can definitely have blood clots, and that can lead to an ischemic stroke, okay? The next thing is autoimmune diseases or inflammatory diseases, basically arthritis, okay? Where it's arthritis and lupus. Lupus is a condition where your body is attacking itself, okay? It's as simple as I can explain it. It's just a condition where your body is just attacking itself, okay? It thinks that you are a threat to yourself. So your immune system is attacking healthy, living, active tissues, okay? So if you have an autoimmune disease or an inflammatory disease or arthritis, then it's a risk factor, okay? And the next thing is lifestyle. So these risk factors I talked about here, they are genetic. You either have them or you don't have them, okay? But your lifestyle risk factors are things that anyone can modify, anyone can also get, and as well, anyone can reverse, okay? So the first is hypertension, okay? So as a hypertensive patient, you are at risk for stroke. If you smoke or you use tobacco, you are also at risk for stroke. If you have excess alcohol use, if you live a sedentary lifestyle, you wake up by 5 a.m. in the morning, you greet your family, you take your breakfast, you go to work. From 9 a.m. to 5 p.m., you are on your laptop sitting down. From 5 p.m., you get into your car, you get back home. In fact, you don't even get back home in time. The traffic, delays you. say you get home by like 8 p.m., you take your dinner and then you sleep, you rinse, repeat. That's a sedentary lifestyle, okay? And it's very dangerous for you. So if you do live a sedentary lifestyle, you are at risk for stroke. And if you've been with me, there was a time I recorded a video of a sedentary lifestyle and the things that you can do to prevent ever suffering from just the health conditions that come with being sedentary. Okay, please go back and watch that video and share it with a friend who might need it. Okay. Also, chronic use of your medications like birth control, hormone medications can also put you at risk for stroke. Stress. Our next topic is going to be stress because it's a very, very important topic, and stress can do so many things you didn't even know stress can do to you. Okay, so stress also puts you at risk for stroke. And also, 44% of people in this world are either insulin resistant, or you already have type 2 diabetes, or you have metabolic syndrome. Metabolic syndrome is just a cluster of diseases that happen together. For instance, high blood pressure, insulin resistance, from there you suffer a heart failure, or you are overweight. They are just different types of diseases, medical conditions that would lead you into suffering a heart disease in the end, okay, or a cardiovascular disease in the end. Okay, so it's also a very live session worthy topic, metabolic syndrome, but I'm not going to go into it, extensively today. Okay. So when I was doing my research on this warning signs of stroke, I came across a holistic and wellness doctor, and what he said is almost exactly what I've been trying to pass on since the minute we met from the first webinar. Okay. And he says that medications are not bad, because you see here that chronic use of medications, hypertensive patients are chronic users of medications, because some of you have been on drugs for over 20 years. I'm talking about daily consistent medications for over 20 years. Okay. Now he says that medications are not bad. They simply do what your body cannot do on its own, even though they can come with adverse side effects, like putting you at risk for stroke. Okay. But it's a lifestyle risk factor. It's not like other risk factors that are genetic. Okay, if you are sickle cell, then you can't really change that. If you already have an autoimmune disorder, you can just manage it. It's not something you can, how do I put this? Your lifestyle risk factors are things that you can change if only you are committed to it. Okay, so he says that you should start to replace those unhealthy habits with the healthy ones. Rejuvenate your cells and your tissues, and your body on its own would reverse your insulin resistance, your diabetes, your plaque buildup, your hypertension on its own. Okay, because you didn't do something that led you here. It's because of your lack of care, you not being able to take care of yourself in a proper way. That is what led you here to being a hypertensive patient today, or putting you in a position of insulin resistance, where you then have to, or should I say, where you are now at risk for stroke. Okay, so you weren't born this way, right? You were not a hypertensive patient since you were a baby. Okay, so think back to when you were first diagnosed with hypertension. Okay, that's not when you started your life. It means that for whatever time prior to your diagnosis, you had not been living a very good life. And now that you are hypertensive, you can simply start doing what you did not do before to improve your health. And your body doesn't need any help from you once you give it what you are supposed to give it, the attention that it needs, the nutrients that it needs, to rejuvenate itself, because your cells are constantly regenerating. Okay, they are not like your brain cells that once they die, they die. Okay, your body cells, your tissues that keep you active, like your liver, your kidneys, your cells, basically the simple units of life, it's constantly rejuvenating. And if you don't give your body what it needs to keep you active and healthy. You would suffer from things like high cholesterol, high blood pressure, diabetes, insulin resistance, etc., etc. Okay, so Dr. Eric, he says that if you want to get off your medications, or should I say, you can definitely get off your medications, you simply have to replace those cells that are already dead and start living a healthy lifestyle. Okay, it's something that you have to be committed to. It's not a one-off thing. It has to be a habit if you really want to continue in that route. Okay, and he also talks about 3 major ingredients to help you if you want to prevent a stroke from happening. Okay, he mentioned 3 things. He says your essential nutrients, which is nutrients that you must eat, your EPA, DHA, omega-3, and your antioxidants. Okay, and these 3 things that he mentioned, it's exactly what is contained in your wellness supplements. Your EPA and your DHA omega-3, it's the end product of omega-3. So your body doesn't have to do any work in converting your omega-3 to either EPA or DHA. It's already in its end products. Okay, so your essential nutrients, your omega-3 and your antioxidants, it's already what's contained in the wellness pack. And when I was doing my research on this topic and I came across him and, you know, his work, it's exactly what I've been trying to pass on to you since the first time we met through the webinar. Okay, so this is something that you should not take advantage of. Sorry, it's not something that you should just, you know, brush to the side. Okay, this is a necessity of life. Okay, and you have it here in its purest form. It's the simplest, it's the easiest way you can get it. And you also have the most powerful antioxidants, not just any antioxidant like vitamin K or vitamin C or vitamin E. All these things are antioxidants, but antioxidants don't have the same potency. So you have the strongest antioxidants already available to you in your wellness supplements, okay? So this, as according to Dr. Berg, 3 major ingredients to help you prevent stroke. You already have them here. And this is something that is also going to prevent that plaque buildup and also deplete plaque so that you don't even suffer from a TIA in the first place that can lead you to suffering a full stroke in the next 7 days. Okay, so this is no longer something that you should just, oh, it's not important, let me just brush it off to the side. It's a necessity. It's a necessity of life. And if you are not getting it from your supplements, then you should get them from your diets. Okay, so you have to choose if at all you really want to get better and if you are very committed to living a very good lifestyle. Okay, it's no longer a want. It's not just something that you have to think about. It's a necessity of life, especially if you are already at risk. That is, if you are already a hypertensive patient or if you already suffer from insulin resistance. Okay, so I have a huge surprise for you today. If you've been with me since last year, October, you would know that I have never done something like this before. When I mean I've never done it, I've never done it. And when I was thinking about doing this, I was having, what's the word, like an argument with myself because this is a huge step for me to take. Okay, now if you've been with me since last year, October, you will know that because of the dollar rise, your wellness pack increased from 35,000 to 40,000. Okay, that is those of you who have been with me, you know, for a while now. Now, I have a huge surprise for you today. And I can assure you that this surprise is not coming back, okay, unless if I change my mind. And I don't think I'm going to change my mind anytime soon. Your big surprise is that you know that your wellness supplements are 40,000, okay, 39,990. For you to unlock a discount from me, or should I say, first, I go as far as giving you all a free delivery. every single time that you shop, you get a free delivery. You're actually enjoying because your delivery fee is being paid by me. I'm sorry, you lost me again, but we are already done. Okay, so I hope that you can see my screen. So I was saying that you are very lucky because you don't get to pay your delivery fee, especially those of you that are not in Lagos or Abuja, and your delivery fee is like 3,000 and above. Okay, I cover all of your delivery fees for you. But I have a huge surprise, and I can assure you that this surprise is not coming back, because even when we had an increase in price, I didn't think twice about it, because I don't think that wellness is something that is a want. Like I've said, it's a necessity, okay, of life. So your huge surprise is, drum rolls, please. You have your wellness pack discounted for the next 4 days. I'm putting this for 4 days. I should even put it for 24 hours, but let me be nice. Let me be a kind person. Okay, so you have your wellness pack discounted for 4 days. People that unlock this 10% discount from me are people that shop wellness for at least 3 times. Or if I want to compensate you, perhaps we had a delivery issue and I want to compensate you for just being a patient and loving person, I give you a 10% discount on your next order. Aside that, nobody gets any discount whatsoever. You pay for your wellness pack in full price, okay? Because you're not doing this for me, you are doing this for yourself. But for the next 4 days, starting right now, your wellness pack is discounted at 35,990, and you don't also have to pay for your delivery. So this is a huge step from me, and I encourage you to take advantage of it. So if you want to restock, or you are a first-time user, or you've been thinking about it for the longest time, this is the best time, because I promise this is not going to come back again, unless if I decide to change my mind. But as it is, I don't think I'm going to change my mind, okay? So this is your huge surprise, and I also hope that you take advantage of it, okay? So let's have some questions now. Do you have any questions for me about the entire session? If not, we can call this a night, okay? Any questions? Also, if you don't have any questions, please give me feedback on the class, okay? How did you see the class today? Was it informative? Did you like it? Did you understand everything that I have said? So if you don't have questions, please give me feedback, because I would appreciate it, and it would help me in my next live session, okay? So questions and comments, okay? I would stay on until 8 p.m. and then I would log off. Okay, so I'm waiting. Please ask me your questions. Thank you. You're welcome, Mrs. Kate. Thank you for your comments. All right, thank you. Please ask your questions now. If you were lost at any point in the class, please let me know so I can answer your question now, okay? If not, you can actually leave the meeting. We are done, okay? But I would stay on till the next 5 minutes. Thank you, Mr. James, Mr. Yinka, Mrs. Yinka, sorry. Please ask me your questions. Okay, I think Mr. Tony, please, are we taking the wellness pack for life? Your wellness is a daily supplement, okay? However, I know some of you are looking for a stable blood pressure, So if you can take it consistently for 12 to 16 weeks, you are good to go. Okay, you should have that stable blood pressure you are looking for. For some people, you may need to take it longer before you then see that stable blood pressure you are looking for. But regularly, it takes 12 to 16 weeks for a good depletion of plaque. Okay, I remember plaque is what causes TIA. So it takes 12 to 16 weeks for a good depletion of plaque. And I thought of something, but I forgot what I wanted to say. But yes, 12 to 16 weeks. Oh, okay. Your insulin resistance as well, because for some of you, plaque is not your problem. Your problem is your blood sugar. Okay. So it also takes 12 to 16 weeks for a good decrease in blood sugar. Okay. Is TIA curable? Absolutely. TIA is curable. It's also temporary. Okay. It's not as permanent as the main stroke. Okay. If I go back to my slide, it's temporary. It cannot kill you. Okay. Very much curable. You can recover from it. Many people recover from stroke. Okay. And a TIA is not even stroke itself. It's like pre-stroke, right? So your TIA very much curable. Okay. Can we get a repeat of the broadcast? Yes, I was recording. So you would certainly have a replay. Okay. Yes, replay would be available when we end this meeting. Okay. I would upload to YouTube and you can watch. Okay, Mrs. Beatrice says, can you please run through the 8 warning signs again? I lost track of time. Okay, so let's quickly run through it. So the first, your sudden weakness, okay? I'm not going to go into detail because I've already gone into detail in the session. So you can simply watch the replay for details, okay? But first, we have your sudden weakness. You also have a loss of balance if you're unable to stand still or you have difficulty moving. You also have sudden cognitive changes, like if you can't understand your language anymore, you can't speak it, you can't write it either. Sudden confusion, you know, things that have to do with your brain, okay? Cognitive changes. And we also have your 5 senses, okay? Extreme nausea, severe headaches, like someone is trying to stab you in your head or someone put a knife through your skull, okay? That kind of headache. Please get it checked out. We also have sudden fatigue, overwhelming tiredness, okay? And also personality changes. So if you see someone who is not looking as good as they used to, then the person should get to the clinic, okay? And also loss of consciousness. So Mrs. Beatrice, I would make this replay available to you, okay? And you can watch and understand everything in detail. Yes, Mrs. Ngozi, I would make the replay available. How many tablets are in the wellness pack? You have 21 sachets in your wellness supplements, okay? And you are to use that every day for 21 days. So this is what you see in 1 sachet. You have 2 omega-3, 1 multivitamin, and 1 astaxanthin, okay? And you take all of this one day, and you repeat the next day for 21 days, okay? And these supplements also help people who are with diabetes. For those suffering from diabetes, your problem is insulin resistance. Now, the wellness pack would not be able to help diabetic patients as much as it will help people who are hypertensive. For a diabetic, you would also need to fast intermittently and also have a very low carb diet, okay? And you would also need to use wellness for a bit longer to see good results for diabetic patients, okay? So it's not something that you could use alone, okay, for a diabetic patient. It wouldn't give you as much results in a period of time as it would for a hypertensive patient. So you would need to go longer, definitely, and you would also need to practice intermittent fasting in addition to a low-carb diet, okay? I am actually researching more on diabetes so that I can also include diabetic patients who need help, okay? But I'm not ready yet for diabetic patients, okay? But in terms of your blood sugar, certainly astaxanthin would be able to help you with that. If you need more understanding on this issue of blood sugar, insulin resistance, you can go back to my live session. I did a live session on fasting and hypertension. I talked extensively on insulin resistance, okay, and how you can also reverse insulin resistance, okay? So please go back to it. Let me see if I can get the link really quickly. I hope that you are still here. You can also go to my YouTube channel. I have all of my live sessions on YouTube. So if you ever miss a session or if you've not been with me when I recorded that session with my audience, you can just look through my channel and you would see it, okay? Mr. Emeka, I appreciate you. You have really opened my understanding towards hypertension. You're welcome. I'm very happy I could help. Definitely, the recording would be available, okay? Can you please send me the link on that live session? Okay, are you talking about the one of insulin resistance, fasting? Is that the one you're referring to? Okay, I'm going to my YouTube now. So please, if you can wait a minute, no problem. If you don't have any questions, you can leave. Thank you for being here, everyone. I appreciate your audience. I really do. Okay. If you don't have any questions, you can leave. Okay. Thank you so much for being here. I just sent the link. I just sent the link. I hope you can see it. Okay, I have somewhere else to be by 8 and it's already 3 minutes past. So please let me go. Okay. Any more questions? Am I free to go? All right. Well, thank you for being here. I appreciate you. Have a good evening. Take care of yourself. Take care of your family. I wish you the best of health, and I would speak to you very soon. Okay? Bye.